My question for the dental deck card was, in which of the following locations would one most likely find yellow bone marrow in an adult? The options were diaphysis of femur, ribs, cranial bones, or the vertebrae. The answer to the question is diaphysis of femur. I thought a good way to remember this would be yellow marrow and then dye, like yellow dye. Yellow marrow is found in the hollow center of diaphysis, which is the long shaft of the bone, which is also known as the medullary cavity. The bones are not solid structures. Cavities in the cranial bones, vertebrae, ribs, sternum, and the ends of long bones contain red bone marrow. This blood-forming tissue produces erythrocytes, which is red blood cells, leukocytes, which is white blood cells, and thrombocytes within bones by a process called hemopoiesis. Before birth, the formed elements are also produced in a number of other locations, including the yolk sac, liver, spleen, and lymph nodes. Erythropoiesis refers specifically to the production of red blood cells. The red bone marrow contains precursor cells called hemocytoblasts, which are multipotent stem cells that give rise to all of the formed elements of the blood. For example, the erythrocytes develop from proerythroblast. The platelets develop from large cells called megakaryocytes. When a child is 7 years of age, yellow bone marrow begins to appear in the distal bones of the limbs, which would be the bones farthest away from the midline. This replacement of marrow gradually moves proximally so that by the time the person becomes an adult, the red bone marrow is restricted to the bones of the skull, the vertebral column, the thoracic cage, the girdle bones, and the head of the humerus and femur. At birth, all bone marrow is red, and then it gradually develops into yellow bone marrow.